Hi, this is Alec. I am going to be performing a video demonstration on how to properly administer medication to a patient through Excelsior. So first of all, what I would do is approach the patient, make sure that they are sufficiently secluded and privacy is ensured for things such as an IM injection or intravenous piggyback medication if the patient is set up with an IV. And so I will confirm they are who they say they are through who they should be, I should say, through two patient identifiers for the sake of this video. This will be the name, first and last, and date of birth also. And once I confirm that it is the right patient, I will use the 5 rights of the medication administration to ensure that it is done efficiently, correctly, and safely. And then I will have reviewed the MAR at this point, cross-reference it's the right time, right site, right patient, all that. I will also ask the patient if they have any known drug allergies or any known food allergies as well. If not, and there are no contraindications, then I know that I will be able to proceed. So I will bring in all of my materials with me as far as the DocuSate that I'm going to be giving to the patient, along with the a 10 milliliter syringe here, and then the appropriate haloperidol, make sure that it's not expired, an alcohol gauze, Schwab, a appropriately sized gauged IM needle, which I have right here for the actual video demonstration. This will be a little bit larger, but for now we will just be using an 18 millimeter by 1 just to demonstrate on an avocado. And then some water so that the patient can drink it down. So after I perform hand hygiene in the room, I will also be donning some gloves. I'll be checking, make sure that the drug isn't expired, as I previously said. I will take out the syringe, attach that luer lock, and I will draw it up correctly by injecting air in it first, and then making sure that the appropriate dose is withdrawn from the vial. Now that that is good, I will put that down, and this is, of course, I explained the procedure to the patient before just showing a needle in their face, and making sure that they agree and consent to it. I will explain the purpose of the IM injection, the purpose of the ciprofloxacin, and they will know that there is some pain, discomfort involved as far as administering the injection through a sizable needle. I'll tell them where the injection will be, which is the ventrogluteal site. I'll have them get in position. And then after drawing up the syringe, as you saw, I will tell them to just pull aside their gown, making sure that the affected area that is going to be used is properly exposed. I will find the ventrogluteal site by placing a finger between the greater trochanter, once I identify where that site is, and the anterior iliac crest. Once I do that, I will clean the area off with a alcohol Schwab. I'll let dry for about 15 seconds, and then I will take the syringe, and with my non-dominant hand, I'm holding that area, stretching that skin. Then I will inject, and then I will use that, sorry, didn't do this correctly, but I will stabilize the syringe with my non-dominant hand and then use the plunger with my dominant hand. after aspirating, of course. Making sure that there's no blood return. If there is, then it will have to be another site that will be used, as it should not be injected directly into the bloodstream. And that is done after about 5 seconds, give or take. And then after that is done, the needle to the syringe will be immediately taken off. If there is a little lock that allows the needle to not be exposed, then that should be locked, and it should directly be placed into a sharps container, which is right here. And then remove gloves and then wash my hands, and just be safe throughout the entire administration. Thank the patient, and then I will document effectively. That's the 6th right is documentation, so I will initial on the MAR to indicate that it has been done, and then I will also document that the ventrogluteal site was done as the injection site. And that should be it.